everyone, and welcome back to the DSS Break. It's great to have you with us today. If you're back, welcome back. If you're new, thank you so much for tuning in. I'm Anna, the founder of Data Science Salon, and today I'm streaming directly from our headquarters, which is beautifully located right in the heart of Miami, right next to the Design District. And we're here live every week to discuss the world of data science, AI, and machine learning. And we chat with you about unique experiences and best practices with leading data professionals in a 15-minute break. And today I'm really excited to welcome Amanda Ford, who is a data program manager at the Mayor's Office of Innovation in my hometown, the city and county of San Francisco. And Amanda leads initiatives that employ sophisticated data analysis to improve public services and safety. And her work involves coordinating with multiple city departments and outreach teams to deploy data-driven strategies that really enhance the effectiveness of services that are provided to really the most vulnerable populations in the city. Thank you so much for joining me today, Amanda, and I'm really looking forward to this discussion. And because I am actually from the Bay Area, this topic really hits close to home because I actually left because of the homelessness, because I was kind of over it almost 10 years ago now. So, and I would not move back from Miami, but I definitely still have love for San Francisco and have family and friends there. So I'm really excited to have you. Thank you so much for joining.
Yeah, thanks for having me. It's great to talk.
Well, before we dive into such an important, deep topic, I would like to know about you and how you ended up in this data space in the first place. And maybe you could tell me a little bit about your journey.
Sure. Yeah. So I've always been really interested in kind of the intersection of data and civic challenges in government. But I feel like up until recently, I wasn't quite sure how to marry those two interests. So one thing that really kind of started this journey for me is I was really interested in astronomy and astrophysics. I had been a special education teacher, and a lot of my students were just super, super into like astronomy and galaxies and black holes, which is what my undergrad degree is. It was kind of a cool way of connecting with people, and I really wanted to continue that. So I went back to graduate school, and my specialty was sort of high performance computing and simulation. So I worked a lot on how do galaxies form, how do they evolve. I ran a bunch of simulations, and then we would compare those with observations from the Hubble Space Telescope. So that was really cool, and I just loved that data work really intensely. But I was kind of looking for a way to apply it in a way that kind of had more immediate effect and kind of was a little more beneficial to people on the ground. So in 2015, I was doing my postdoc over in Germany, and that was kind of when big data and data science like really started to become a thing. And I had friends in the astro world who had started work in Silicon Valley, and they were like, hey, we're doing some cool things with data. You know, you can use data for education, you can use data for healthcare. And I was like, that sounds really exciting. So I moved from Germany to the Bay Area about 10 years ago in 2015. And I started in some smaller startups. I did an agriculture startup. I did a healthcare startup. I worked at Google on Google Maps. It was really cool to see like how data helps people just like literally navigate their world. And then about 2.5 years ago, I saw the job posting for here in the mayor's office. We were spinning up this mayor's office of innovation that was funded by the Bloomberg Foundation. So it was externally funded. And the whole goal was to use data to sort of innovate in the civic space. And I was like, that sounds really interesting. I wonder, how we could use data to make San Francisco a better city. So that was November 22, and here we are.
Cool. Well, it sounds like you're a big asset. So I'm glad that you're there. And now let's dive into the whole thing about how do you guys, first of all, gather and utilize the data that actually supports the efforts, the street efforts in San Francisco?
Sure. So one thing to note is that we have a lot of teams in San Francisco that are doing street outreach. So some of these are spun up over the last couple of years. Some of these are relatively recent, and many of these were spun up in kind of the alternatives to policing model. If someone is homeless, they have a mental health issue, how do we support them? How does the city kind of respond to that? So over the years, we've kind of developed this pretty big network of systems. We have 4 different departments, again, not including police, 4 different departments. There's a total of 12 teams under those 4 departments that all go out and do street outreach. And they do a lot of work. They have thousands of encounters with unhoused individuals every single month, and they collect a lot of data from those encounters. So the task for our office was like, how can we use that data? Can we use that data to improve what we're doing? Because we do have a lot of effort and a lot of resources that are going out. And I think it's a matter of figuring out, how do we make sure that we are doing the best job that we can? Where can we improve? How can we make it better?
Awesome. No, that's really, it sounds like that's actually a really raw way to collect data that is not, I feel like we don't really hear that as much anymore, but I feel like it probably is more accurate. I mean, is it recorded on like a recorder, or do they actually write it down? Okay. Yeah. So that makes it really accurate. Yeah.
It's a great question. And I was really curious. I like to kind of think about data from soup to nuts, if you will. And so I was able to go on ride-alongs with several of the different outreach teams and see how they work and see how they are getting their data. And it's really mixed, right? It's everything from, it's completely automated. It's in a fire department rig. They have a state-of-the-art system like in their fire truck, to more, it might even be pen and paper, because again, it's really personalized, because some people, if a big fire truck approaches them, that's really intimidating. So there are teams that are kind of meant to be a little more softer touch, a little more light and easy. And it's everything from Microsoft Forms on mobile apps to notes and pen and paper to really more high-tech systems, depending on the need. And there's really pros and cons to each system. And I think our teams have done a good job figuring out, what are their niche? Who are they trying to reach? Which part of the unhoused population are they trying to work with? And what's sort of appropriate for that type of interaction?
Got it. No, that's really interesting. Yes. And I hope that AI can improve that stuff, right?
I think there's some promise there. Yeah.
Yeah. And what are some of the biggest hurdles in applying data science to these kind of problems? I'm sure there's a bunch. Right.
Yeah. So I think the first one that we kind of slammed into when we first started this was the data was really siloed. So as I mentioned, we have different departments. And just to give an example, our fire department is one of the teams that goes out and they respond if someone's having an overdose. And they actually are authorized to test out different treatment modalities. So they might give somebody, one type of medication and someone else a different type of medication, depending on the individual circumstances. So that's their input. How do they treat that overdose? And they want to measure the output or the outcome. Like, what happened to that person? Did they survive? Did they recover? And learn, like, what's better, in the future to give to a similar situation. But what was happening with these data silos is the fire department or whoever was responding would keep the record of like what type of overdose intervention they had done. But then the hospital or the medical examiner would be keeping the record of what happened to that person. Did they survive? Did they not? And they really couldn't share data in an automated way. And that was really problematic, right? Because data science is, you can relate inputs to outputs. You have input variables, you have a response, you have X, you have Y. And if you have those two things together, there's all kinds of amazing things you can do. But if they're separated and X doesn't know about Y and the input doesn't know about the output, then you can't use modeling, you can't use AI, you can't just do basic analytics. So that was sort of our first challenge, is like, how do we integrate this data better?
Got it. No, that sounds like, it sounds like he solved it, right? Maybe we could talk about maybe a success story, maybe a problem that you've solved, or maybe an outcome of the city initiative that you've seen and since you've been there. That would be super interesting too.
Yeah. So I think what I'll talk about is this population that we're kind of calling our high utilizers. So when we were able to link the data, so now we have records for about the past 2 years. It's about 15,000 individuals, depending on how you count, because sometimes we don't have complete identifying information. And we have over 100,000 encounters. So we have a pretty good database here. Mm-hmm. And one of the first things we noticed when we started analyzing that database is we had sort of this bimodality in our population. So over half of the people were only seen once, like the vast majority, 3/4, were seen 3 or fewer times. So just really not seen a lot. But we had this group of what we started calling high utilizers. These were people who only represented about 10% of the population, but they represented 50% of the encounters. So these are people who were seen, 10 times a month, 60 times over the course of a year, maybe 100 or 200 or 300 times by our systems. And they clearly weren't getting their needs met because they were just coming back over and over again. So that wasn't a super surprise to anybody. But what we were able to do was actually make a by name list of like, here are these people who are high utilizers, and then cross reference it with some clinical information. So these are people who we wanted to identify, who might be at higher risk of premature death because maybe they have an overdose history or something like that. So we were able to identify those people on a by name list. And then we had a small pilot that we ran just for a few months last year to go out and say, let's find these people. Let's see if we can do more targeted intervention. So that's where our partners on the street outreach teams, like were boots on the ground, went out with that list of names and looked for those people and tried to figure out how to provide higher quality care for them. And the results for that, to me, were pretty, it was a small pilot. We need to figure out how to scale it. But to me, it was pretty remarkable because these were cases that a lot of people thought were intractable. These might be people who have a long history of homelessness, maybe substance use, maybe schizophrenia, or other really complicated medical challenges. These are really tough cases. And what we found is over 2/3 of people in just a few months were either in shelter or housing. And then an additional kind of 2/3 set of those were also making really significant progress on sort of their medical history, whether that was starting medication or being connected to a long-term case manager. So again, we need to figure out how to scale that, but that was really encouraging for us of like, hey, we're at least, we've got some evidence that we're on the right track here.
No, that's great. That's a really great story. So no, that's very encouraging to hear. So thanks for sharing that. And now let's talk about data privacy concerns a little bit. I know you said there's some of these individuals don't have a lot of data, but I'm sure there is still some kind of concerns with data or bias or anything like, things like that.
Yeah, absolutely. So what we were trying to do is definitely figure out how to find the right balance between really respecting the privacy and also providing top quality care, right? So I think we had to kind of look at it from both angles because we just couldn't continue with the system as it was of just these data silos. We're making it impossible for us to figure out really how to improve our system. So one of the things that happened in California in 2018 was we had an assembly bill passed that basically said housing is healthcare, which sort of makes intuitive sense, right? Like if you're sick and you're unhoused, like how are you going to get better if you don't have a safe place to be? But what that did legally was that said under HIPAA, which governs rules around healthcare, housing is now part of that. So housing providers and healthcare providers could start to share data, which we were really excited about because that impacts someone's housing ability as well. So you can imagine if someone is in a wheelchair, they shouldn't be assigned to a shelter on a third floor of a building. Like that doesn't make sense. That's not going to work for them. So here in San Francisco, we used that assembly bill and we kind of carved out this legal framework that allowed housing providers and healthcare providers to be included in this sort of case conferencing and to be able to discuss someone's case just like you would if you were, getting surgery and you wanted your medical surgeon to be able to talk to your anesthesiologist about your case. So that's where we felt, strongest about this care coordination is really vital to helping unhoused people. But I will say we had some things that we didn't include. So there were certain things that we felt like were just too protected, too private, and we decided not to include them. So those were things like HIV status or domestic violence status, which maybe that wasn't the right call. You could imagine someone's domestic violence status would impact their housing, but we just felt like that, was so sensitive and protected that we didn't want to include it, at least for now. So that's kind of how we thought about managing that trade-off.
Got it. And what collaboration is required across different city departments to manage and analyze data effectively?
Yeah, so I think it's absolutely everything, and we could probably be here for hours. But I think the main thing for me is, it's not just technology. It's not just, the database and the data pipelines. It's everything from how the data is collected to how it's recorded, to how the pipes work, to everything. So as I mentioned, the people that are out in the field, these outreach workers that are doing this work, they use a variety of different tools, and some of the forms work really well and some of the forms were like, very old and not helpful. And so we noticed that when we looked at the data, like, hey, the data quality is not super good. So just as an example, one of the things that our office was able to flag was this one particular form that one of the team was using was just kind of not helpful. Like the outreach workers were like, this is really hard to use. The data that I was getting was like super unclean. There was a bunch of errors. Like nobody was really happy with this, but there weren't resources to fix it. So my office was able to do a partnership, a public-private partnership through a program we run called Civic Bridge. We had a private tech company come in and they revamped the form, and that was really successful as well because my data is now cleaner and the people out recording the data were happier. It was easier for them. But that's just an example of like, it really is this holistic picture. Like you have to think about data not just at the end, but you have to think about how the data is collected. Is it easy for outreach workers or whoever's tasked to collect the data? Is it easy for them to input it? Because if it's not, you're not going to get the data that you want.
Right. No, that's a great answer. And next question I have for you, what technologies have proven most useful? Like what is your tech stack that you like to use?
Yeah, that's a good question. So I came from Google, so I was very used to this like, integrated Google world where everything is sort of by one owner and it kind of, runs more or less seamlessly. Of course, that's not how the real world works. So I think for me, anything that helps integrate data and connect data, that has been really what's been helpful for us. Not so much like individual applications, but just anything that makes it easier for us to share and anything that makes it easier for us to prototype. So for example, we launched an outreach worker tool as part of this project where outreach workers could have access to this integrated data. So they could see a little bit about a person's history and make a more appropriate housing recommendation or referral for them. We were able to build that just like in the Microsoft system that we use here in San Francisco as part of Power BI, and it didn't require like an extra, app development or something like that. We were able to sort of prototype that more or less in-house. And I just think tools like that are sort of quick and easy to prototype have been really helpful for us. Whether that ends up being the long-term solution or not, I'm not sure. But for us, it was just important to kind of just iterate quickly so we could learn and we didn't get stuck in this like very long government timeline.
Got it. No, that makes a bunch of sense. And we talked a little bit about impact for individuals that you guys made, which is amazing. But maybe you could tell me a little bit about the data-driven interventions and how they impact the community as a whole.
Yeah, so one of the things that we have been starting to look at, I don't have results for this yet, but we're really starting to think about what does it mean for our housed residents and our businesses as well, and kind of what are they looking for out of this system. So we basically have 3 or 4 different audiences that we're working with on this project. One is, of course, unhoused people directly. The other is the people that serve them, the outreach workers, and then people who are in San Francisco. We have our residents, we have our merchants, we have our tourists, we have all of those people. And how do we sort of communicate with all of them how we're working on this and how we're holding ourselves accountable? Because as you mentioned, there are a lot of people that see what we are facing in San Francisco and say this is completely unacceptable, and they're really frustrated by it. And so for us, we're thinking a lot about how do we communicate the results that we have and how do we make sure that it's clear to our residents that we have a plan and that we know what we're doing and that we can make this better. So it's early days on that, but we're starting to think through, what does it sort of mean for government to have transparency metrics and for us to be accountable. And I have a colleague who's our service designer and we've run some workshops. I think it's really interesting, and especially with some of the new tools coming on board, I'm excited about different ways that we can get feedback and we can be a little bit more tied into what our community needs from us.
Cool. No, and you kind of answered my last question was about kind of what you're looking forward to. So it sounds like there is a lot of new things coming. And I mean, another kind of question that wasn't on there. I mean, I was thinking like, have you guys thought about actually putting cameras out to track I know it's kind of like Big Brothery, but maybe to track people and collect data that way. So, or is that against like the actual privacy laws of San Francisco?
So
having robots or something go and look and make sure people are okay. Like, do you know what I mean? Like utilizing those kind of tools. I mean, I don't know if that's allowed, but it seems like.
Yeah, so that's something that would not be part of this project for a couple of different reasons. But I think for for this type of project, there's a lot we can do without that type of surveillance and without kind of having to wade into those privacy questions. There's so much we can do without even getting into that I think it's kind of worth seeing how far we can get. I think from a public safety perspective, there are things like the cameras that the police department is doing here in San Francisco. But as of right now, this project is sort of intentionally separate from that because our model came out of this sort of alternatives to policing. So yeah, that's where.
No, I got it. No, I think, hey, I think everybody wants a personal touch. So I think I'm more for that kind of vibe anyways. But thank you so much, Amanda, for joining us. I really like your pink jacket.
Thank you.
It's really fabulous. Is it a whole suit or is it just the jacket?
It's just the jacket, but I will say one of the fun things about working here in City Hall is that we have a lot of weddings, and particularly in February because it's Valentine's Day. So when I first started, we had almost 300 weddings here in my building on February 14th. And so I learned that if I'm going to come to work in February and photobomb people's weddings unintentionally, of course, just wandering around the building, I'm always in the background of somebody's shot. I should dress festively for the February celebration. So.
Well, you look great. I love the look. Pink is my favorite color. So, it looks great. And if you guys enjoyed this session with Amanda, she's actually going to be with us in person in Austin just 2 weeks from now. So I'm really looking forward to meeting you there. Make sure to bring another bright color to wear.
Great.
Yes. And we're almost sold out. So make sure you guys grab your ticket. And if you can't make it in person, we will share the content on demand after. So it was such a fun conversation. And even though it's a very deep conversation, I feel like you guys are doing such great work. And thank you so much, Amanda, for sharing everything that you guys are doing. And thanks for tuning in, guys, and have a wonderful rest of the week.
Thanks so much. Bye-bye. See you in Austin.
Bye.